Well, Dr. Stephen C. Hayes, welcome to the show.
I'm glad to be here with you both. It's awesome.
Wonderful to have you. I've followed your work for years, and it's just it's a real privilege to get to meet you and have this conversation today.
Super. It's nice to meet you, and through that to the people you serve. So thank you for the opportunity.
Right on. So for those in our audience who are less familiar, with your work, you are the founder of Acceptance and Commitment Therapy, a popular and effective therapy. Can you tell our audience the basic premises for those who are listening who are unfamiliar?
Sure. Well, ACT has been on a 40-year journey. It's a combination of, at the level of what people do under that label, typically of acceptance and mindfulness processes and commitment and behavior change processes. But it has a specific goal, which is to change the degree of the person's psychological flexibility. And that is a little different because while in the modern times, there's a lot of different kind of acceptance and mindfulness things out there. It's entered in just into our lives. It's in our culture. It's in our practices and so forth. Back when I was starting, it wasn't quite like that. And so ACT has been on a developmental journey, goes back to 1981, coming out of some of my own struggles. And we took, I say we, me and my lab, an increasingly larger group of folks. Now, 10,000 people in the main society, about 5,000 studies, 450 randomized trials. It's huge. But back in the day, it was me and my 5 graduate students. And what we decided we needed to do is figure out why it's so hard to be human. And so underneath it is this model of psychological flexibility, which is essentially what happens if you try to hack the human mind with a kind of evidence-based process focus, where you want not just a theory, but you want processes that really work. In other words, you can see them, you can measure them, you can target them, you can change them, and when you do, things happen that are predictable. And so we kind of were invisible for almost 20 years, from the earliest days and the earliest randomized trials to the first book almost 20 years later. And it wasn't because we weren't working hard. What we were doing is figuring out what are those processes. And I can summarize those in just a semi-long paragraph. Let's see if I can shorten it. It's basically, if you can learn how to be more emotionally and cognitively open and flexible and bring this more witnessing, pure awareness, sense of self into the present moment and allocate your attention in a flexible, fluid, and voluntary way that allows you to focus on what's really of importance to you. What are the features of your own life moments that you want to manifest or bring into the world, and then build habits around that. If you do that, life opens up, and everything that we push into syndromal categories is less likely to happen, less likely to be severe or chronic, less likely to build multiple problems. And beyond that, all the behavioral health kinds of things, diet, exercise, sleep, etc. And beyond that, all the social and social justice kinds of things. So, but everything from diet and exercise and all that to, running your clinic or having a relationship that works or winning a gold medal at the Olympics. I mean, I know that sounds weird, but it's just true. There's actual randomized trials or controlled studies that's everywhere showing that we just do a better job of being human and living a life in a way that fits what you really want out of life. I don't like thinking of that as sort of act uber alles. There's a lot of methods out there that move psychological flexibility, including pretty traditional CBT and other things like that. And certainly, more systems oriented or Gestalt or, psychoanalytic. I mean, we've been doing this work for a long time, our wisdom traditions. But I want to bring Western science to it. I want to really kind of hack it, figure out what it is so that you can target, change it, and benefit from it. And that allows you to not be quite so geeky and give people tools they can use. And
what does the process, Stephen, look like, let's say over the course of 6 months to a year? Just kind of highlights of like what's actually happening in the therapy that's causing this flexibility to happen.
Well, you got to apply this individually. I think it's a mistake for evidence-based medicine, for evidence-based practice to have been shoved into one-size-fits-all protocols for syndrome space. I think we really, when you understand it, it's the same thing with personalized medicine and the rest. If you really understand what the processes are that are involved in health and that ameliorate some of the problems of ill health and disease and both those features, well, then you need to look at the person's strengths and weaknesses. What's going on? You can't just sort of say, hey, everybody needs this. It's not true. And that's especially true psychologically. It's true biologically, true social culturally. And we're used to saying it has to fit the cultural background. It has to, that same message. It has to fit the person as a physical system, as a psychological system, as part of a social group. But with that caveat, typically people come in being rigid in a few areas. The most common ones are they've overused the problem-solving mind to look at their own thoughts, feelings, memories, bodily sensations. And they've brought this kind of judgmental analytic tool, which is great when you're doing your taxes or fixing your car, but it's a train wreck when you're trying to find peace of mind or purpose. And when you do that, when you bring that analytic judgmental thing, you get into a thing of, I have too much of this, or I got to get rid of that. Well, what are you talking about? Very often it's things that are part of your history. And they're going to follow you. Plus, those very things are useful sometimes. And in a way that's real hard to say in a simple rule. I mean, can you name a human emotion that's not useful? Can you name a human emotion that you don't pay good money to produce? You yourself.
I love human emotion as long as it doesn't stay around for hours and years on end.
Exactly. But what makes it stick? We didn't evolve to have emotions stick. But you can get it to stick. I'll give you an easy way to do it. You're talking to a panic disordered person in recovery. Turn panic into an enemy that signals really bad outcomes are about to happen. Now track the indications that it's come and do whatever you can to avoid it so that it doesn't. You might as well go put your finger in a wall socket over there. Just find, every panic disordered person has the same history. All different routes in to the same history. They may have had a bad drug trip. They may have had an illness. They may have, faced a really potentially trauma-inducing situation. In my case, I'm sitting in a department meeting with full professors fighting in a way that, as I say in my TEDx talk, in a way that only full professors and wild animals are capable of. I'm watching them fight like hell. And, unbeknownst to me, I had a history of domestic violence as a kid. I could remember that and say that, but unbeknownst to me and how deeply it penetrated, it was only on the ACT journey that it showed up how deeply it penetrated, hiding under my bed at 8 years old, wondering whether or not, I'm going to see blood on the floor when I came out from underneath the bed, and hearing my parents scream and throw things at each other, and then I'm sitting in a freaking, psychology department meeting, and I'm having my first panic attack. Well, under extraordinary circumstances. And I'll tell you, by the way, yesterday was a really bad day for me. I mean, watching those folks storm the things, I'm just like quaking and shivering and crying. And I'm sure I'm not the only one. It isn't just the horror of the politics of it. Some of that is echoing stuff that happened way back in your history. And your whole body's going like, whoa, because that's how we're wired.
Absolutely. And obviously yesterday that resonates not only with our personal history, that resonates with hundreds of years of insurrections and reminding us of that.
No, absolutely. And, and your underlying neurobiology is set up to take advantage of your history. You want to be able to respond to things that are dangerous, etc. Yeah, but if you misapply the logical problem-solving mind, which is this evolutionary recent adaptation, it's 1,000 times more recent than the basic learning principles that are programming your underlying neurobiology. That kind of process of operating classical conditioning is 500 million years old. What you're doing when you say, oh, I don't want to feel anxious, is a couple 100,000 to a couple million years old. We know that because, and this is part of the geeky stuff that's underneath ACT. We have an entire active research program on language and cognition, where it comes from. And we can take kids who don't have a sense of self, who can't speak, et cetera. We can bring them forward in a way that's faster and more successful than anything known in Western science. I'm sorry for the self-praise, and we just can't. We know more about how to get language going, but we started with the dark side of it. And, so this evolutionary reset and adaptation of figure out how to get rid of it and get rid of it, this problem-solving repertoire that evolved probably for cooperation initially as the social primates that we are, that's another story, gets misapplied. And now your question, why are we stuck with anxiety? You want anxiety to come and go. You don't want to, as a panic disorder person in recovery, you don't want to live inside panic disorder. It's almost unlivable. You can't do the simplest freaking thing.
Sure. Well, it's torturous.
Yeah.
And
so of course you're going to say panic is my problem. No, actually panic is a reflection of what? Well, anxiety is my problem. No. Holding anxiety is the problem and trying to deliberately not have it, that is panic disorder. That's what that is.
So it sounds like you're saying, so ACT is developed to basically unhook this problem-solving mind. Is that what ACT is about?
Put the mind on a leash, use it when it's useful and not. Learn how to make those discriminations, not just in a verbal way, because that's feeding the problem-solving mind again. It's listening when you tell it, I'm going to put you on a leash. It doesn't like that. Because it's a one-trick pony. It knows how to evaluate, predict, compare, and suggest strategies for, avoiding and controlling. And, it'll tell you. If I said, you can only say good or bad, and I said sad, you'd say bad. If I say happy, you'd say good. If I say anxious, you'd say bad. Yeah, but as I say, there's no emotion that's not useful sometimes. And, if your mom's on her deathbed, sad is what you want.
When you talk about emotions being sticky or sticking around with this judging function that you're talking, kind of prefrontal cortex function, it kind of through my lens as an integrative psychiatrist, I think about all the ways that we can be sticky with our experience. And there's the mind component that I think you're talking about, the psychology, and developing the witnessing and getting unhooked from that, from your story, from the narrative, from the emotion. But there's also, it's interesting because there's also the biochemical component of being sticky and getting stuck. And for instance, when people stop, and just to give you an example, when people stop eating foods, like for instance, in my practice, it's often the case that when somebody's sensitive to gluten and they're inflamed and they have brain inflammation from eating the wrong things, it's much harder for them to overcome the panic you were just talking about.
Sure.
And you could take a piece from any place on the map of all the different ways people can be sticky. So
I agree. And it's a complex system. They interact.
Right.
And so, and they're at multiple levels, so I'm a psychologist, I'm talking the psychological level. But if you just look at the underlying neurobiology of what we're talking about, let's take something like chronic pain or something. You can show that connectivity is linked to these kind of psychological things I'm talking about of avoidance and, evaluation, buying into the thoughts, etc. Sense of self you mentioned. Well, sense of self will harness parts of the brain that actively filter out sensory motor information in such a way that you're not even living in the same world when you're inside some narrative. You literally don't have access. It's literally not making it to the parts of the brain where you could have access to the actual world you live in. And why psychedelic therapy or something can land well with people is it opens up some of those gates. You have a clue as to what's actually going on right now in your life, because you've got these habits at a neurobiological level of filtering out as you buy into that narrative self. So it's at all levels, and it's interactive with the dynamical kind of system. And these issues of diet, exercise, sleep, when I'm doing workshops, I say, how many people ask questions about that? Everybody raised their hands. I said, how many people are in here old enough to answer this question? 20 years ago, did you ask those questions? And nobody raises their hand.
Right.
Nobody. So we've learned, but I would really like to have the basic, science that really digs into how. So, for example, the example you used, my guess is there's specific neurobiological systems that are being engaged that are also engaged in, for example, just what you and I are doing right now, that are closer to these sort of processes that can be moved around by language itself. Language penetrates and harnesses ancient systems. I mean, alligator brainstem level systems are being harnessed by stuff that's 1,000 times more recent evolutionarily. That's how it works. And so
one of the things that I'm most excited about in that vein of kind of what's underneath this overlinking that happens is the field of psychoneuroimmunology and this kind of overactivation of the brain's immune system, and how we can modulate that. And the really fascinating, I mean, so many different studies coming out on how psychotherapy can modulate that and how diet can modulate that, mindfulness, et cetera.
Well, the geek side of it, I mean, I have a feeling I've been talking to a couple of geeks who are used to not talking as geeks, but they're very weird things that, even you start thinking of this as a complex system, as dynamic systems and so forth, doing the good science that one at a time allows us to pull these things apart is going to be damn hard. And let's be honest, this will sound critical, but I can apply it to myself. So there's some woo-woo that happens inside integrative psychiatry that makes me worried. You really have to get down to science that's a level above even what we usually think of to start looking at exactly how did that, for example, nutritional thing harness, for example, that part of your underlying neurobiology in such a way that it interacted with, say, that trauma experience such that this thing's harder because of that. That requires treating people as individuals. Just look at how the brain is connected. If you're not actually doing the work to look person by person, and you're just going by part, yeah, but that's the average, and the average isn't the person. Then you know what a train wreck that is. People can.
I agree. Yeah,
have connectivity that's not even, it's way off the normal maps, but it's there. All you got to do is look for it. If you spend the time in the scanner, you can.
Right. So, I mean, we have to be precise and treat people as individuals. I'm wondering about going back to this question about developing the witness, and is that forgive my ignorance of the ACT model. I'm wondering about how would you explain the acceptance component? Is that what that is? Is it the witness?
Well, the witness component in the psychological flexibility model, that witness component, the acceptance component, all 6 processes are interrelated. If you try to do it with self-reports and stuff, you'll sometimes get two, but it'll basically factor into single factor. But they have 6 aspects. And I usually say it's like a box, 6 sides. You roll it over, it's 6 sides. Yeah, but there's only one box. And if you take a couple sides out, it's not a box anymore. So it's kind of 6 that are one, different levels.
So maybe it would be helpful, Stephen, to let's actually hit what the 6 processes real quickly. Let's touch on
okay. So acceptance or emotional openness. Flip side, experiential avoidance, running away from your own thoughts, feelings, memories, bodily sensation. Cognitive fusion, flip side, cognitive diffusion. Fusion, taking what words say they are to be literally what they are versus noticing that you're having a thought right now. You're having a symbolic, categorical event occurring, a particular kind of learning that is pretty new on the planet, relational learning. You're having a thought. This witnessing sense of self, as opposed to what? Well, the conceptualized self, the storied self, the narrative self, the evaluated self, the I'm a person who, fill in the blank self. As this witnessing self is the know thing self. That's why it's really hard to name because it's not it-like. It's nothing more than here, now, the fromness of awareness, not even awareness of anything. And the geek science underneath ACT has pulled that at its joints. We can say some things now about what that is. That's why we can help kids who don't have that, more severe on the spectrum kind of kids, for example, and help establish that, which then will create problems for them. Because it leads to other things. But anyway, so that the witnessing self. Then there's the present moment contact, but I like thinking of it more just in terms of flexible, fluid, and voluntary attentional control. To past and future, not literal past and future, but thoughts of the past, thoughts of the future that are occurring in the now, and to broadening or narrowing, shifting or staying attentionally in the now, which is the only place we ever are. Then there's the values piece.
Then the values piece.
Is
that one of the processes?
Values are one of the processes. So far, I've named 4: emotional openness or acceptance, cognitive openness or diffusion, flexible, fluid, and voluntary attentional control, versus disappearing into the past and future habitually, and witnessing self or conceptual self. The last 2 are the ones where the rubber meets the road behaviorally. Values: what are the qualities of being and doing that by choice, just between you and the person in the ear, not because of a wagging finger or mama said so, not because of the holy book. You still have to make your choices. Great, those are holy books, but the books don't do it. You have to do it. What? You have to choose what you're up to. What do you care about? What do you want to manifest? What do you want to reveal? What does this next moment of your life want to be about? At the level of an adjective or an adverb. Lovingly, Al. Not what you want to have, not what your goals. That can be fine on a journey that's values-based. But what is the journey about? That's up to you. And then, can you build habits of actual life choices, of behavior, meaning little b behavior, everything you do, of action? Can you build habits that are organized around your values, around, love, contribution, justice, etc., and not just around running away from your fears and things of that kind?
Yeah, that's super helpful to hear, just the outline. I'm curious, let's dive into acceptance for a moment. So that term has a lot of meanings in a lot of places. So let's tease this out a little bit, right? Because you could, some people are going to take that, especially in spiritual communities, they're going to take this term and say, yeah, I'm just going to accept everything for the way it is. Everything for the way it is. I'm going to accept my behavior for the way it is, and I'm going to accept other people's behavior for the way they are.
It's a train wreck. Why? Because cognitive fusion, language will carry you. There's a core of what acceptance is about. I wish we had a better term. Self-kindness is closer, maybe. Self-compassion, maybe. But those have problems too. Any word has problems. It really does. Anything. This is back to Cratylus, the Greek philosopher, whose final lecture was a wagging finger, because to even say a single word was to create a 2, and he was trying to get to the 1. That language is a tricky horse to ride. But the root word of acceptance is a Latin root, septere, I believe what it is, that means to receive as if to receive a gift originally. And it is there in English, barely. Here, will you accept this? If you have something precious, here, would you accept this? You don't mean, would you tolerate this? Would you resign yourself to this? Would you just give up? That doesn't mean that. And acceptance is used as an epithet. I mean, chronic pain folks, just look at what people around them are saying. You just have to learn to accept it. In other words, shut up. Why? Because I don't like feeling what I feel when I see you feel what you feel. So don't talk about what you feel, so I don't have to feel what I feel, which is just bullshit. It's like it's an attack on the other person. But the root of acceptance is essentially saying yes to your own experience. Not that you like it, not that you want it, not that you're missing it, but that it's okay to be you. Now, when you say yes to external things, that's a different deal. Those are things that you have choices about in terms of having or not. If there's dirt on the floor, I'm not sure I want to accept it. If my kid hasn't taken a shower in a week, I'm not sure I want to accept it. But if I'm talking about my history, if I say no to my history, please explain to me how I can start from here and live a life.
Well, it's a really helpful distinction. Yeah.
I'm going to have to wait for my history to go away before I can start. Right. Good luck with that.
Right.
And that's what our clients are doing.
So it starts with saying yes to our internal experience.
Yeah, always. Always. Now that yes doesn't mean put up with it. If you're being abused by someone, for example, You need to be open to the experience of what it's going to be like to stop the abuse and maybe leave that relationship. And we've showed at very first randomized trial in the modern era, we did a couple or three to know you're on the right track in the early 80s, shut down, did all the basic process work, philosophy of science work, measurement work, so forth, came back out with two more randomized trials just had come out in 1999. Now there's 450, but at the time it's just but one of the earliest one that we came out was done in a call center by Frank Bond and again Bond and Bunce 2000. And they worked on acceptance skills with these call center workers. And when ACT then hit, a few years later, was written up in Time, 5-page story, get out of your mind into your life, beat Harry Potter for a glorious week and all that. Immediately I'm getting it. Oh, you're just trying to get people to accept their lot. You're just... you're part of the elite establishment. Well, let me tell you what happened in the first study when ACT was looked at. There was a technology to teach people to take control of their work environment and eliminate stressors. Had been previously validated, kind of a behavioral, you go for it, change your work environment. Okay. There was a control condition. I forgot exactly what it was, reading something in this call center. And there was an ACT workshop. People's stress and so forth plummets in the ACT workshop, not in the other two. That's at post. At follow-up, the ACT folks are demanding changes in their work environment at the same level as the folks who were encouraged to do that in the first place, which, by the way, did not reduce their stress. Why? Because when people are more emotionally open, more cognitively flexible, more in this witnessing sense of self and focusing on their values, they start doing things like, this is scary to go to my foreman and say this, but this is not right. The way we're doing things here is driving me nuts. I can't do my job. It's not fair. Like that. And we've since found out that if you have a flexible workplace and flexible workers, you got all kinds of great, wonderful things happening in the world of business. People love working together. They naturally start cooperating. Things happen. Stress goes down. Productivity goes up. It doesn't have to be, like the Uberization of the bad to beat up on them, but of go kind of piecework craziness that we're getting into with what's happening in our economy. You can empower people to create environments that are kind environments. A study, if I can, I don't want to go too much longer, but a study that followed that study that was done with stockbrokers. Same thing happened, but what did they then do? They started demanding things like, we're going to have a family day once a month and bring our kids to work. Stockbrokers. Could we humanize? But you're not going to do it if you're living inside fear. If you're living inside pretense, if you're living inside ego, you're living inside narcissism, you're not going to do it.
Right. And you're not going to do it if you're bracing. Right.
Yeah.
If you're, yeah. Here's another piece, which you've spoken about a little bit, and I want to hear a little more about is the issue of values. Now, one of the things that Keith and I talk about a lot is that it seems like people who are empowered and on a path of empowerment have to encounter at some point or other what their values are. And is this a very specific protocol that an ACT therapist actually does with clients?
Yeah. Well, we have a number of them, and we were kind of onto it early. It's not like it's been absent in the deeper clinical traditions. It's there. But, when mindfulness was sort of westernized and brought into the healthcare system, it was one of the ones that was left behind because, you can give your religious leader and so forth sanction to talk about right action and talk about values. But when you're putting it into a healthcare system or something, it seemed like you couldn't do that. It's a disaster not to do that. You don't want mindfulness without values. You start getting stuff that only in the West would we do, like, you take care of the kids. I got to go meditate. What? That's not what that's for. So we better have a way in, and we do. There's 4 basic pathways in, and there's maybe 40 different kind of exercises, metaphors, etc., that are well elaborated, measures, etc. in the ACT. It's expanding all the time because people are very creative. Once you know the processes you're changing, it's like once you know what the underlying physiological issue is you're changing, and you can target it with different meds or different things. But the same things happen in the ACT universe. We've kind of turned the researchers loose, so they're. But
and so you there's different. What I'm hearing, if this is right, there's different paths to helping a person determine their values. Is that what you're saying?
Exactly.
And in ACT, has the research found that people have a hierarchy of values or no?
Well, kind of, yes. I mean, as you get deeper into it, depends exactly what you mean by values, but we mean chosen qualities of being and doing that are intrinsic to behavior itself. Intrinsic to behavior meaning small b, action itself. So we don't mean goals. We don't mean compliance with a set of standards or things like that. You can, by your choice, have religious faith commitments, so your values can line up with books and so forth and with religious leaders. That's all cool. But there's an ownership piece there. And the 4 ways in from an ACT point of view are take your pain and flip it, and you'll find it. Places where you hurt are the places that you care. Take sweet moments, unpack them, and inside that is something that you value. Look at your heroes and guides and just look at who they are and what they stand for. The people that move you, empower you, lift you up. The people you respect and look up to, you're going to find your values there. And if you think of your own life as like a matter of your authorship, that, authentically, genuinely, you're writing your life and you can choose the theme of the chapters of the book, but not the characters or the challenges that showed up. The themes that you're picking, those are values. So sweet, sad, guides your heroes or your chosen story. By story, I don't mean your interpretation. I mean the arc of the journey that you're on, right? So those ones that I know of, and there's like scores of specific methods, exercises, and so forth. A lot of them are easy to get. So if people are wanting to learn about these, you can easily go to the internet and stuff, or stephenchayes.com, or not just the ACT community, the Association for Contextual Behavioral Science, and find these things.
And is it your, whether it's your philosophy or the ACT philosophy, that so there's some theorists that say that from a hierarchy of values, your highest value is your purpose. It's the thing that you're most going to constellate around in your life, more of a single pointed value. And then other people say, actually, your purpose is an integration of a big set of values. I'm curious what your philosophical belief is on that.
Well, some of what's being talked about there, and it's in a new book called A Liberated Mind. It's over my shoulder, my latest kind of trade book, but it's also used for therapists. Human needs, human yearnings, hierarchy of needs. I mean, Maslow got me into psychology originally, all way back when. Some of that is talked about sometimes as kind of a hierarchy of values. What we're talking about with values is that kind of chosen purpose end. But these other ones are also linked to things we yearn for. Like, for example, acceptance is linked to a yearning to feel. And we come out of the womb ready to do that. I mean, we're reaching, licking, smelling, tasting. We will just, nobody has to teach us that, right? This kind of attentional process. We yearn to be oriented. We look around. We will work for information, and babies will work just to see outside the window. Brand new neonates. I want to see what's going on. I want to see where I am. I want to, like that. This kind of sense of self that we're talking about, this observer witnessing self, language builds it out. And we now know how it builds out, which is a cool story. It's how we can reach kids on the spectrum and so forth. But it starts with something that's into our basic biology as the social primates they are, which is, the whites are around our eyes so we can even see where mama's looking. We're dumping natural opiates when mama's eyes first contact us within hours of birth. And the only other creature on the planet that does that is dogs. And they've been around us for 10,000, 12,000 years. They've evolved some of these things. So, and what does that reflect? A yearning to belong, I believe. Yearning for meaning, values, yearning for competence, these kind of the behavioral side of things. And babies will work for hours to do nothing more than be able to reach something. Nobody had to teach them to do that. There's no M&Ms showing up. It's just instrumentality. And
So
it better be there by birth, because you got so much to, I mean, you're the one who doesn't know how to walk. You don't know how to reach. You don't know how to do anything. So maybe you suckle, a few little kind of,
a yearning to grow.
A
yearning to grow and a yearning to develop and to challenge yourselves.
Develop competence, to be able to sort of interact with a world that's increasingly better able to. The only one I've skipped of the 6 processes, I think, is the one that's inside cognition, which is this yearning to understand. I think it's there even before human cognition, which is, being able to sort of predict. Like animals will work for information, including things like you're about to be shocked, even if it's unavoidable. Why would you want that information? Well, it's because sort of understanding is something that is sort of built in. Once we get language going, boy, do we put that on steroids. And so, we're fighting for trying to understand and have a good story and have it all fit together. I tell people that it's a cool study that kids in preschool, their single most common fight is over who's right. And if you don't understand that, just have a staff meeting. They're still doing it. So those are, now the reason so this is a long kind of blithery answer to some of what's being talked about in terms of hierarchy, I think, are the hierarchy of I call them yearnings. I kind of don't like the demanding quality of needs. And if you had to put them into hierarchy, I would say, boy, belonging is first, because you hop out of the womb and you better be connected to the other social primates there, or you're going to die really fast. You ain't cute. You don't know how to connect. You're a pain in the ass to be. You better have the tools, or you may die within days. These other things of feeling, yearning to feel, or to be competent, to understand, to be oriented, to have meaning and purpose. Those sort of unfold, and I think you can inside that put a whole bunch of other things. I mean, because let's say something like chosen purpose. You might want to reveal beauty in the world. You might be an artist or something. It's just really important. Well, that links to things like feelings, and it links to things like belonging. But it's also just a chosen value. That beauty is something of importance for me. That might not be your thing. I mean, you may be really interested in understanding how the brain works and interacts with the gut biome, with the psychological processes to be able to help people who are suffering. That's probably much more, probably more cognitive in some ways, more linked to competence and being able to figure out rules for how to have good things happen for people.
Yeah, I'm not much of an artist, that's for sure.
Yeah, there's an art to doing it, but it's probably not like looking at a sunset. Now, some people do, like mathematicians. Otherwise, sometimes they can talk about the beauty of the solution, and then if you're into the work that you do, sometimes you come up with a beautiful diagnosis, probably, or a beautiful intervention strategy. But it's a bit of a metaphor, I think. I don't know if that's a good answer. No,
that's a good answer. Let's tie it together now to so you have these different processes. If you're working with different aspects of the inner dimension, linking it to behavior, what's the aim of ACT? So I get so one thing you said is, well, you create this functionality where there's fluidity, responsiveness, these different aspects. What's the aim in terms of the human experience that we could sort of hope for from developing through ACT?
Well, I want some guidance from the person as to what they really want. I can't just ask that question up front, because I want to be rich, I want to have a lot of money, I want to have fame. That's a bunch of bullshit. When you dig through it, it ends up changing. So you really need all the processes in order to really be fully elaborated on any of the processes. Like we hurt or we care means if I really renew my values, but I'm not emotionally open, boy, I've got a problem for myself now, because I know where I hurt, but not what to do about it.
But is the aim like empowerment?
Yes,
internally and externally? Is it experiencing a baseline of joy, and like what's the sort of overall aim of what the human experience could achieve?
I think it's to come into the present moment fully as a conscious human being, as it is, and that is what it says it is, and to take steps that move you in the direction of your chosen values at all levels, socially, physical health, psychological health. And those processes will link to, I've been talking the 6 psychological processes, but you can scale them socially. Acceptance scales to compassion. Diffusion, being able to notice your thoughts, scales to understanding and really wanting to hear the voice of others. Competence steps into relational competence at the social level. At the biological level, I think some of the same things kind of happen in terms of diet, exercise, etc., but not just that. I mean, we know, for example, let's take something like what happens when people are more psychologically flexible in terms of their basic underlying, very basic biological systems. Well, for one thing, you start seeing epigenetic downregulation of stress-related gene systems. You just don't need them. You're not in that same harsh environment anymore. You start seeing changes in brain connectivity where are no longer kind of jerking over and pulling possible aversives into the present moment. Why? Because you're tracking it verbally, and you got that kind of default mode network hum going on, looking for, and grabbing and pulling in things that could, and so you're activating this kind of problem-solving part, and you're harnessing basic kind of sensory motor systems to detecting danger and all kinds of crazy stuff you don't need to do. If you could simply learn to sort of be here, there's no lions and tigers and bears where you are right now. I mean, you don't not need the full kind of watch out for danger and run systems anymore. You're not a kid, and you're not in a wild animal park, So how did you put yourself there psychologically? So we have a model of that is published in a couple places. I've got a piece coming out in World Psychiatry, which you may know World Psychiatry, the highest impact psychiatry journal in the world, a Target article, myself and Stefan Hoffman, but we've been walking out several of these. We've got a special issue of Clinical Psychology Review, where what we basically do is take an evolutionary model, an extended evolutionary synthesis model, and try to integrate the biological level, the cultural level, and the psychological level by taking all the processes of change that we know about in these levels and thinking about them this simple way. How can we create healthy variation? How can we select those when we bump into them and healthy variation gives us a partial solution or a step forward? How can we retain it when we see that it's there to be selected? And how can we fit it to context so that it'll be deployed when it's needed? Variation, selection, retention, and context at the right dimension and level. That's the extended evolutionary meta model. And when you take a process focus, you don't have to be thinking about ACT or something like that. You can just think about how can we as professionals get together to what are the unhealthy processes, what are the healthy processes at a psychological, at a sociocultural, and at a biophysiological level. And how can we create healthy variation, selection, retention, and context that feeds the purpose? And I know that's kind of abstract in a way, but it's not abstract when it plays out with an individual person. Stefan and I have a book, Stefan Hoffman, I don't know if you know his work, but a major kind of CBT guy, have a book coming out on a process-based therapy workbook where we're walking through how to use dynamical systems and complex systems, ideographic, high-density measures, ecological momentary assessment measures, etc., to be able to track these processes and to be able to sort of model how they interact with the individual enough to know how they intervene. That's way geeky. I'm sorry for that in a way, but I'm just saying we can get on the page where the kind of science that we need to be able to focus on processes that matter and change those for people is not very far away. We have a massive amount of data, and the integrated psychiatry data are a cool part of it.
Well, that's really exciting, actually, Stephen. Thanks for the hope that you think that we're on our way with the science, and I agree with you 100% that it's got to be The science is the way to bring everything forward. It's the same thing in the psychedelic medicine revolution, and we've got to have the science.
Have you been involved some in the psychedelic work?
Yeah, I was a part of a handful of MDMA psychotherapy trials with the organization MAPS, and you know, it was a real eye opener for me as a psychiatrist in a nutshell to see how much faster people could get well and stay well.
And you look at the processes of change. You know, what is that oceanic awareness? What happens in terms of acceptance? What about the values piece? You just look at it, and there's an underlying neurobiological reason for it. But you may know that ACT is being used as a model for pre-prep of, you know, especially the ones that are more limited number of doses. I'm not down yet with the chipping for months on end kind of psychedelic. I'll have to see the data on that, but I'm absolutely down with and kind of helping to support and work with. And that community is very active. We have a little special interest group on psychedelic therapy. In part because the psychological flexibility processes move with psychedelic therapy, and it's what sticks. It mediates. It isn't just they move. They're not just correlates. They mediate the outcomes. So that means they're functionally important. So when you know that, it helps to orient people towards it. And I think we've been doing that with indigenous peoples forever. If we're going to take it in the West and put it in without all those, without the rituals, without the symbols, well, we better have something in there. Don't be throwing chemicals at people. I lived through that. I'm a child of the 60s. It is not pretty. You know, next thing you know, it's you know, addicts on the sidewalk with needles in the gutter. I am not interested in doing that again.
Were you like this as a kid, Stephen, in terms of like your passion for knowledge and synthesizing and creating information, or this was more in your adulthood where you got, I mean, obviously you got a lot of books behind you. You're probably very well read. So I'm just curious, like, have you always had this kind of intensity?
Oh, yes. I'm hypomanic all the time. Always have been. But, you know, some of it comes out of just this kind of mission, you know, of I tell a story in my TEDx talk of, you know, being underneath that bed at age 8 and saying, I'm going to do something, meaning I'm going to get out and stop the fighting between my parents, which when I realized that thought fully forms, I just scoot farther out behind the bed because it would have been physically dangerous to my health to do that. I saw my brother almost got hit by my dad when he tried to stop our fighting. And so I just kind of, you know, but to me, there's something deeply moving about being able to alleviate human suffering that is just makes sense of my life. So I just do it. And this kind of energy is around I'm not very interested in sort of trademarking and having it be about me. I'm really more interested in leading from behind. I want to empower us as a community to focus on what's important and get it into people's hands with tools they can use. And Western science is the best way of doing that ever invented at its best. At its worst, not so much.
Sure. Well, you know, everything's got benefits and drawbacks, right? And so Stephen, what do you want to highlight anything you're up to right now? Anything you want people to know about, a book or anything?
Well, I suppose what I'm most working on right now is how to really create an integration at these different levels using an evolutionary model to do it in terms of orienting clinicians towards what's important so that we can ideographically use a process-based focus. So we've got functionally important pathways of change that we're focusing on, which means that it probably has some treatment utility. That we're not going to come up with categories of syndromal categories that have 250,000 different ways that you can get that category. It's just nonsense. I mean, in the history of medicine, when you do stuff like that, that only works if there's a few processes that can produce those manifestations. As soon as there's a bunch of different processes or the same process can produce a bunch of different manifestations, we're into the cancer situation, and botanizing cancer did not work. You know, so stop botanizing human suffering. You know, start looking at what are the processes, get down to the basic lab, but play nice with, you know, people who are on the front lines. And so that's one thing that excites me. But another one is I'm working hard at trying to put these tools into apps, websites, things like that, that will land with Joe Sixpack. You know, I look at the political situation we're in and so forth, and I'm saying, look, you know, one reason why people are so subject now to crazy, you know, kind of conspiracy theories and so forth is the world feels completely out of control. You just look at it and it looks nuts because you're exposed with that computer in your pocket to levels of horror that your grandfather was never exposed to unless they went to war, to levels of comparison that you'd have to be, you know, living inside a newsroom to be able to produce, and a constant flow of judgment. And comparison, judgment, and pain are the toxic triad. So we look at our young people and say, what the hell is going on? Well, what the hell is going on is we're putting stuff into their lives and giving them no healthy tools other than commercial stuff, including Big Pharma being way too aggressive about, you know, categorizing and then, you know, way over medicating, in my opinion, but higher doses, longer term that the body ever evolved to handle. So I'm in a project right now. I don't know if you have the minutes. Can I take 2 minutes to talk about my newest
take
project?
a couple minutes, sure.
Just a couple minutes. So one is to try to create a clinic that will take us from mental health problems to human prosperity, social and physical prosperity. So yeah, you get treatment and it's funded by a guy in South Carolina, big financier and so forth. I don't think I should mention his name, but the clinic is called Modern Minds. Anne-Marie Albano, well-known CBT person. What we're going to do is process-based act, yes, for anxiety, depression, etc. But once we get traction there, what about diet and exercise? What about the things that you want to do? How do you get involved with other people? What do you want to volunteer on? Can you go back to work? What about, that's one. And then another one is an exciting thing that I'm into, just starting with how do we put apps, websites, etc., into basically critical workers' lives, largely minority, very much overburdened folks. Can we get out of this woo-woo talk and you got to go find a wonderful therapist you never could find anyway and you couldn't afford it if you could, and put tools into people's hands that would empower them when people don't have much money and they don't even have the laptop to frequently go to the website. You know, just get it onto their phone. So that's another game.
That's great. Well, this transitions to the last question we ask everybody. Basically, we ask everyone the same question. If you had a billboard that every human being would see once in their life, it had a paragraph on it, what do you want to tell people with that paragraph?
A thing you'll get, I don't know if this probably would be a foolish thing because it may not land well, but if you get an email from me, at the bottom of the email, I'll say, love isn't everything, it's the only thing. If I had a way to actually reach the person reading the billboard with what I think that means, which is I think you can treat yourself in a more loving way, and out of that, you can manifest what you really want to. And, you know, I have worked in the prisons. I've worked with murderers and rapists. You know, that was where I started. Get out of your mind, in your life. My big success story was written for prisoners. And then a tragedy happened and I wasn't allowed to test it in the prison because the new director came in and said, we just lock, feed, and count. You know, we're zookeepers. And I was never able to test it there. But, you know, that can we put enough love in the world that even people who have found themselves in that crazy cul-de-sac of violence, and they could find a way to be what they really want to be. Because when I dig down into people who are suffering and people who are criminals and people who've done horrible things, what I found is, you know, honorable people. I mean, people who yearn for, you know, you look at I probably shouldn't say it, but you look at a Donald Trump, let's say, and you say, that person had a tough life. It may have looked like the golden life, but no, not that level of disturbance, that level, somewhere in there, I want to make the bet, is a human being yearning to be more loving to himself and to others. So I'll go with what's on the bottom of my email. So love is
very beautiful.
It's the only thing.
Thanks, Stephen. That's beautiful. Well, Stephen, thanks so much for being on the show.
It's been a pleasure.
It was awesome. Thank you for the opportunity.
Yeah.